question is, I have a frozen shoulder and have been told I should have a steroid injection. Would you recommend it?
Okay, so frozen shoulders. Well, let's just go back a little bit and keep commenting if you have any questions and we'll come through them and go through. So let's just go back a little bit and talk about what frozen shoulder is, and then we can go through what the treatment options are and see if we think a steroid injection is worth doing. So a frozen shoulder, as it sounds, is to do with shoulder pain. Usually people come into us with frozen shoulder that is of gradual onset. So there's actually two types. There's what we would call a primary frozen shoulder and a secondary frozen shoulder. So a primary frozen shoulder is one that happens for no reason, insidious onset. Patients will come in and say they can't really identify why their pain started. Usually the pain is sort of at the top of the shoulder and can refer down a little bit.
Who would you say is most common in frozen shoulders?
Well, from the studies and that, we know that it's most common in those between 40 and 60 years of age, and a little bit more common in women than men. It is definitely related to people with diabetes. So 3 to 5% of us have a risk of getting frozen shoulder, but if you have diabetes, you're 20% likely to get frozen shoulder compared to the normal population.
And what if you've had frozen shoulder, and what's the risk of developing it again?
I don't know if you want to hear this, because if you've got frozen shoulder, it's not great.
Oh yeah, okay. But if they've already had it in the past, they might want to know.
We see this a lot. So someone will have developed one frozen shoulder, and then there's actually a 20% chance that you'll start to get symptoms on the other side. We don't know why either. It goes through a few different stages we'll talk about, but what actually happens with frozen shoulder is the tissue that connects our bones together, the joint, capsule and ligaments, they, for some reason that we don't know, they start to, we think there's a little bit of an inflammatory process at the start, and it triggers contractures of that joint capsule, and it tightens the capsule. So that's the tissues that connect the bones together, not to do with the muscles. The capsule tightens, and then that restricts shoulder movement. So at home, if you think you have frozen shoulder, there's a few signs and symptoms. The first thing is pain, obviously, around the shoulder. It usually doesn't go below the elbow, but can come down the arm. The second thing is that you've lost joint range of movement. So some people have problems with their shoulders where if they lift their arm up, it's sore, and therefore they don't lift it up over their head. If you have a frozen shoulder, usually you will lose range no matter whether you try to move the arm or not. Regardless of pain, you cannot get your arm usually up over your head. First thing that happens is, I don't know if you can see this in the camera, but you lose rotation. So you can't move your arm outwards. If you compare it to the other side, one will move out nicely, the other will be really, really stiff. And that's one of the first clinical signs we look for in clinic. The second thing then is when you move the arm off to the side, you usually can't get it past 90 degrees. Same thing up in front. So a true frozen shoulder, no matter how hard you pull with the other arm, you won't move it up. And in terms then of what are the symptoms people say, so commonly people will notice that they can't move, like putting on their clothes, hand behind their back, up overhead, trying to brush the back of their hair.
Night pain, lying down.
Yeah,
night
absolutely.
One of the biggest ones, I would say.
And that's why they often come in, because they're not sleeping at night, particularly if they lie on the affected side. It's waking them up at night time.
So what would they do? What would you suggest if someone had a frozen shoulder?
Okay, so in terms...
We'll come back to the question. The question is
yeah, sorry,
injection.
we're getting way off cue here. In terms of treatment for frozen shoulder, so it's tricky. This condition has been going around for a while. We know what it presents with clinically, but how do we treat it? First off, conservative management approach. Physiotherapy is definitely worth a go. In clinic, we would give people, if we think about the phases of it, so the initial phase is usually pain, and then it'll start to get stiff, and then towards the end the pain will reduce a little bit, but the arm will be really, really stiff, and in the last phase it will tend to start to resolve itself. So in that initial painful stage, from a physiotherapy viewpoint, we will try to keep the range of movement. So when patients come into us with frozen shoulder, we will start them on exercises to maintain their movement. So things like using the other hand to lift it up overhead. We often do stuff with a broomstick or golf club to get that arm movement, to try and maintain the range they have and try and improve range as much as we can.
So movement, then what?
This is where the steroid injection comes in. If, we've tried a few sessions of physio and that patient still isn't sleeping at night, then that's probably when I would consider talking about a steroid injection. What do you think?
Yeah, if they've tried anti-inflammatories a regular course, not just one every now and again, if they've taken them regularly, if they can.
What you would talk to your doctor about,
yes,
this is not something you do off your own bat, you would speak to your GP about pain relief
adequate
first.
Pain relief.
Yeah.
And if you're taking adequate pain relief and it's still not having an effect, then I would go down the route of steroid injection. But as far as steroid injection goes to improving function and improving, speeding up the recovery, there's not much evidence to support the steroid injection. I would be just doing that to ease symptoms and ease pain.
I would
It's
agree.
not to speed your
We would use it for patients that are not sleeping at night and we're not managing to settle that, or if they can't do their exercise because it's so sore. So you're using it as a usually it gives short-term pain relief, if we're honest here. If you're lucky, a steroid injection will give you short-term pain relief. It's very rare that a steroid injection will resolve your frozen shoulder.
And let's go a step further. So we'll say this person had the injection and it hasn't worked, and then they've been suggested, which a lot of people have, a manipulation under anaesthetic.
Yeah, so
just what is that?
And there is other treatment options, and this is where it escalates for sort of a frozen shoulder. If you're doing your physio and it's not improving it and you're still in a lot of pain, where does that leave you with treatment options? Well, steroid injection probably is our first protocol. It may be worth a go to see if it helps. Then we would look at, and again the research here is, it's not telling us we should be doing this. Like, there is options like hydrodilation, isn't it? Hydrodilation.
Again,
that's where they take anaesthetic and they inject it into the joint capsule to try and stretch the joint capsule. But the research shows that the outcomes at 6 and 12 months are no better than physio alone. And then manipulation under anaesthetic. This is where they knock you out and they put you to sleep. Sorry. They put you to sleep. In other words, you can't feel anything, and the surgeon then takes your arm and gently tries to move it through range as best they can.
I wouldn't say gently.
Yeah, we don't know. Like, some people might have had it, and some people have found that it has improved range.
Yeah, comment if you've had it. Actually, yeah, let us know if you've had it and what you've thought of it.
And then manipulation under anaesthetic. It has got more risk than the hydrodilation because they can actually tear the tissue while they're doing it, and the patient can be in an awful lot of pain after. Sometimes it might improve range, sometimes it may not. But if a patient is really struggling and they're not coping with their symptoms, these are the options that are before them. But you would try conservative management first. You talk to your GP, your healthcare professional, to refer you on to a specialist to ask them those questions. The other option then is the release, arthroscopic release.
Yeah.
So this is where you do a small surgery, a keyhole surgery, to go in and actually cut the soft tissue that it has the contractures in it that's causing the stiffness. And the studies on this too are still, we're not sure whether we should be sending our patients for this or not. There is some stuff that says it can improve range. Don't know, you could go through the arthroscopic procedure and not have any improvement afterwards. So it's a really tricky one to manage. I think going back to just sort of the physio viewpoint on this, for my patients, and Ollie, you can put in your 10 minutes here, if somebody comes in with a through frozen shoulder, I get them first of all straight away onto their exercises to maintain range of movement. I will try a course of manipulating the shoulder, mobilizations on the shoulder, but if after 4 sessions I'm really not seeing any improvement, then and that patient's pain is manageable, so they're sleeping at night, they're managing their activities pretty good, I will tell them to keep going with their exercises and really just discharge them from care. They can get back to me if they need it, because we do know that these shoulders do resolve over time. Yes. Some people can get quicker, better with physio, but if they're not responding, we just let them go, continue their exercises. That's for those that are coping with their pain levels. If you're not coping with your pain levels, then we will discuss things like steroid injections.
Okay, that's enough.